Okay, good morning, everybody. My name is Rani. I'll say a few words about my background so you know where I'm coming from. I've been practicing Chinese medicine since 1990, which is 22 years. I actually started in Japanese acupuncture. I was living in Japan. I studied shiatsu and Japanese meridian therapy. And after that, I was trained in normal TCM and herbal training. And I did this for a few years, and then I was trained in classical Chinese medicine, which is 5 elements and stems and branches acupuncture, if you've heard of this. And this is what I've been doing and teaching for the last 15, 16 years.
For the camera, sorry.
Okay. Well, we have to accommodate the camera. Morning.
Thank
you. Well, in the beginning I was teaching in a TCM college, and I was also working in a hospital in Israel. I was one of the founders of the first complementary medicine units in a hospital in Israel. And then the more I got into classical Chinese medicine, I found that I couldn't teach so much in the schools anymore because the schools teach TCM, which is okay. And so today, mostly what I do is I work in clinic. I work 4 days a week from the morning until the night in the clinic. And then I teach usually postgraduate courses. So I teach sometimes a year-long course, which is stems and branches acupuncture, and sometimes more specific subjects like pediatrics or gynecology, fertility, which is what we'll be going into today. So, we're going to be talking a lot about the extraordinary meridians. And maybe the first thing I want to say about the extraordinary meridians is that they are the foundation which is behind life. And we'll see this in a moment. And they're always in the background during our lives also. And this has very much to do with how we look at the extraordinary meridians and how we treat the extraordinary meridians in the clinic, because as you will see, I'm going to be talking to you today about very special points and very special point combinations and techniques, and it's going to sound fantastic and magical, and you're going to go and want to do this all the time in the clinic, and I want you to do this. This is why we're having the seminar. But I want to stress that because the extrameridians are the foundation of life, and they are actually the background behind what's going on in life, usually they should take up a very small part of your clinic, of your treatments, because problems, imbalance in the extrameridians should only be addressed after you have a better balance at the level of the life of the person. And this is because the extrameridians are at the root, at the core of the person. And imbalances in the extrameridians are usually not inborn. They're usually something that's created through the process of life. And they're created because the body cannot manage the situation at the normal level of the qi and the blood and the zang and the fu and the 5 elements, which we will be talking about today. And so because the body cannot manage the situation, the only way to survive is to push the imbalance downwards into the extrameridian system. And we'll be talking in a moment about how we diagnose this. But what this means is that when we come to treat the person, we need to understand that the imbalance, this very deep and very powerful imbalance that we're seeing, is only caused because there was an imbalance at the level of man. And if we don't address this imbalance at the level of the person and of the life before we access the extra meridians, then our treatments will have a very short effect. We will see a change, but then the imbalance will come back, and then there will be a change and it will come back. And this is not what we want to do. So what we want to do is we want to understand and treat the life of the person. And after we have seen a change in the reason actually that the imbalance was pushed down to the level of the extra meridians, then we access this deeper stage and we release the imbalance and we promote the better flow of energy at the level of the extra meridians. And if we do this properly, then we have a cure. The problem does not come back.